Welcome back to Today's Health. In this segment, we're going to talk about shoulder issues related to the rotator cuff with Dr. Timothy Lukas. Now, Dr. Lukas, can you go over an overview again of the rotator cuff in the shoulder?
Sure, we'll pull the anatomy picture up. So again, the rotator cuff is made up of 4 tendons. You have 1 in the front, 2 on the top, and then you can't see the one in the back, the one in the back. The most common area to tear actually is the 2 tendons on the top. And again, those are the muscles that help raise your arm over your head and help position your arm in different places in space.
What are the symptoms of a rotator cuff tear?
So patients that have rotator cuff tears, they almost consistently complain of pain going down the side of their arm. They also have catching and clicking as they get in certain positions. They have a difficult time reaching behind them and overhead. They can have some weakness. They may not be able to perceive the weakness, but they may have some weakness as well.
And how do you diagnose a tear in the rotator cuff?
So going back to our earlier segment, I would examine the patient, see what their motion is like, see what their strength is like. If I suspect a rotator cuff tear, I may order an MRI. An MRI will help define how big of a tear, if it's a 1 tendon, 2 tendon, or even a 4 tendon tear. It'll also define how far that tendon is pulled off of the bone. That'll give me a better idea of whether it's fixable or not. Chronic tears tend to develop scar tissue in a process we call fatty infiltration. We can see that on an MRI. So MRI really can help us define how bad the problem is and whether or not we can fix it or make things better.
And then once you do diagnose a tear in the rotator cuff, what are the initial treatment options?
So initially, unless there's an acute injury, if a patient comes in with a year history of shoulder pain, it's getting worse, we'll try conservative measures. Anti-inflammatory use, ice, rest, and then a period of physical therapy to try to stretch things out, try to mobilize that shoulder, try to get it moving and as in good a function as it can be, to see if that helps with the symptoms. I may even try an injection of cortisone, a potent anti-inflammatory that's put in the space right around the rotator cuff to try to get rid of the inflammation, try to help the healing process. Not something you want to do repeatedly, but initially sometimes one injection can be quite helpful.
Now, these treatment options, are they sometimes effective in making it more comfortable so that it doesn't get worse and you can recover and heal from the tear?
Yes, absolutely. The vast majority of people don't need surgery.
Okay. If those measures are not effective, then what are the surgical treatment options?
So that's one of the actually exciting parts of orthopedics today. Rotator cuff surgery has really progressed in advance. We can do all rotator cuff tears that are repairable. We can do it all arthroscopically. So we're just making poke holes around the shoulder for that. So you can see here, little half-inch incisions around the shoulder to get the camera, which is a really high-definition camera. We can see the anatomy so well with the camera these days. It's better to do it this way than to actually make a big incision and open things up. And then we put these small instruments in to do the repair. The repair is actually done with something similar to a drywall screw that we anchor in the bone, and then that's connected to suture that helps press that rotator cuff back against the bone where it tore off of.
So what might the patient expect during this procedure and recovering from the procedure?
Let me go back one step. I want to show you some pictures of actual rotator cuff repairs I've done. I'll pull one of these up. So here is the rotator cuff. This is the edge of bone that's pulled off of, and you can see the gap there, that hole. So that tendon is pulled off that far from the bone, and then we'll show the repair. So now you can see that tendon is actually pressed up against that bone, and the suture holds that in place, and there's an anchor in the bone that holds that. And that biology takes about 6 weeks for that tendon-bone junction to heal. And we'll show a little larger tear on the next picture. You can see a bigger gap, a 2 tendon tear. So we fixed that a little bit differently. We have to put, we'll show the next picture, a couple of anchors on the side, and then crisscrossing sutures to press that tendon up against the bone to get that junction to heal.
Now, I have heard that this procedure can cause quite some discomfort. How long does it take to be able to return to normal function?
So it really depends on a couple of things. One is the size of the tear. Larger tears take longer to heal. And the biggest process is the biology. We have to let the body heal the tendon to the bone. And that takes 6 weeks, no matter if you're young or if you're old. It takes at least 6 weeks. So if there's a tear, we have to immobilize for a period of time. And then once we have enough healing, then we start the therapy process to get that shoulder moving and strong again. So 6 weeks of relative immobilization in a sling or a brace, depending on the repair. Some patients I'll also use what we call a CPM machine, or continuous passive motion machine, to keep things moving without putting undue stress on the repair so scar tissue doesn't form. And then once we have the biology taken care of, then we start therapy to get that shoulder moving again.
So after the 6 weeks, what happens then?
So if it's a small tear, they're going to therapy, and we'll focus on restoring their motion first, and then start with the strengthening process. And usually that's a 2 or 3 week process before we start strengthening. With larger tears, I'll actually work on getting their motion back, but we won't start the strengthening process till about 3 to 4 months, because we really want that to fully heal before we start stressing or straining that repair. So most people after 3 to 4 months are doing well. It can take a year to fully heal after this process, though.
Wow, that's quite a process.
Yeah, but in the long run, I think it's worth it for patients. It gets rid of their pain, it gets them back on their sleep cycle, which is really important for all of us, right?
Doctor, this is great information. It's time for another break. We'll continue in a moment.